known John for a couple of years. He's been another networking group on it. I've talked about his insurance plan. He lives in O'Fallon with his wife and their two sons, 14 and 24 years old. I believe you are an independent insurance agent, is that correct? And that's he's gonna get down a little bit of information about Medicare for you, I think. So how about you?
I don't know about dazzle you, but I appreciate the opportunity to come out and explain and talk a little bit about it. I'm here to, as you can see, talk about eliminating some confusion around Medicare. At least I'm going to try to. Yes, I'm John Burgmann. Clarify for people, make sure they understand who I am and what I do. I'm the owner of the Burgmann Insurance Group, but I don't work for the government. I don't work for Medicare or anything like that. I'm also not an attorney or a tax professional. Sometimes I get questions from people like that. I have to refer those out. A little bit about me, getting into it. My business helps people plan for retirement and plan for healthcare expenses with retirement. There we go. I am a board member of the Elder Justice Council in St. Clair County. If you're not familiar with them, it's a great organization devoted on making sure people are not taken advantage of or not scammed or anything like that. I do a lot of community outreach. I have monthly Medicare Q&A sessions at the Glen Carbon Library, quarterly ones in O'Fallon, and I also teach at Kaskaskia and Lewis and Clark College. Why do I do all of this community outreach and why am I so passionate about it? I mean, you guys have your own reasons for what you work in with Rotary. My reasons are for how I was raised. Back when I was growing up, I grew up in Lebanon. Dad was military, and I'm going to try to talk fast because I know we're running a little bit late and I had planned for a set amount of time. So I'm going to talk as fast as I can on this. When I grew up in Lebanon, when I was about 12, my grandma came to live with us after my grandfather passed. And I didn't think too much about it. Grandma was finally there, got to see more of grandma. But next thing I knew, new instructions were sent out that said that we got to make sure that grandma doesn't go out of the house by herself. She's not allowed to leave the house. She's not allowed to answer the phone. She's not allowed to talk to anybody at the door by herself. Now, I kind of wondered what grandma did to get grounded because that's what happened to me at 12. But in her case, I learned that grandma had dementia. I didn't really understand anything about that. But what I did understand is that we took the time and care and we cared for her as much as we could, as long as we could. And that lesson didn't have as much impact on me until several years ago when my own mother, and there's my two boys, if you can see them, my own mother was starting to have cognitive issues herself after a head injury she sustained. And we had to change the conversation to, no, mom, please don't buy that off the internet. No, mom, you don't have to give money to every person with a sob story who knocks on your door. You have to take care of yourself. And I realized that some of the experiences that I was having working in this industry, and I've been in this industry for over 12 years now, some of the experiences that I've had, and the reason I was so passionate about working and helping to prevent those was because of how I was raised. Things like I've had clients who, I had a client down in Heron, Illinois, who had $250,000 in medical bills. This is her portion of the medical bills after believing she had insurance that was going to cover 100%. You think that affected their retirement plan? Yeah, just a little bit. Had a client down in Creole Springs. Bonus points for anybody that knows where Creole Springs is here in Illinois. It's down kind of southeast of Marion. Got visited by an insurance agent from Cape Girardeau who, in a matter of 35 minutes, talked him into canceling his life insurance and transferring the assets over to another one, which essentially cut his death benefit and his cash value in half. And even though we filed complaints against him, we couldn't do anything about fixing it because he signed the paper. I know a lady over in Dix, Illinois, who had 3 insurance policies, the exact same type at the exact same time. How can that even happen? Well, she was spending all of her time at the nursing home trying to help take care of her husband and spend time with him and didn't worry about the bills. I've even had people on fixed incomes come up to me with a bank statement and say, John, do you know what this is? They were signed up for programs without even knowing about it. Okay, and that's scary. And that's just a sample of the experiences that I've had with people that I've been working over the last 12 years. So I do a lot of community outreach. I make sure people have good factual information because I learned you treat everybody like family. So when it comes to Medicare, I mean, Medicare is a government organization, a government program, and obviously nothing that does anybody here work for the federal government before I get into this at all? No, okay. Nothing that the government does is ever confusing at all, right? What's so confusing about Medicare? Let's just take a look at it locally. If you look at it, and you'll learn here in a second, there are over 7,000 possible combinations of plans for people to pick from in this county alone. There's multiple different enrollment windows, and there's constant change in the laws with how people are addressed or marketed to, which is always confusing. So I'm going to take a couple seconds. Some of you, by the color of the hair that I see out there, some of you already know a little bit about Medicare, and some of you probably don't know anything about it at all. So I'm going to share with you a little bit about how Medicare works, just so you can understand the complexity of the situation that people are faced with. So on your tables, there is a page that looks like this. This page comes from a book. Let's go back to that one. There we go. Comes from a book called Choosing a Medigap Policy. It is a book published by Medicare. I just didn't have 50 copies of it, so I made a copy of the one page that's most important. And this page talks about the 4 different parts of Medicare. Medicare is easy. Medicare only has 4 parts, A, B, C, D. How can that be difficult? Part A is hospital coverage. This is everything that has to do with you being an inpatient in the hospital. Doctors, nurses, the bed, the oxygen, the crappy food, all that stuff that comes from being in the hospital. Part A is available to people if they're eligible for Social Security. Okay, so there's no cost to that. Part B is the medical side of Medicare, which is doctor visits, lab tests, durable medical equipment, MRIs, CAT scans, therapy, that kind of stuff, outpatient stuff. And Part B does have a premium, and those 2 parts together, A and B, are what's called original Medicare, and they're primary insurance for some people, and they cover roughly 80%, as you see. The premium for Part B is $164.90. Now, that's medical, and that doesn't cover everything. As I said, it only covers up to 80%. What about drugs? Well, that's where Part D comes in. The only naming convention that Medicare got right, Part D for drugs, right? So with Part D are programs that were that structurally were created by Medicare, but they're offered by private insurance companies. They have a monthly premium, and you figure out which one is right for you. In our county, there's currently 24 different individual standalone drug plans for you to pick from. How do you pick the right one for you? It's a good question. After we have the 80% covered and we have our drugs covered, we still have 20% left behind. 20% of medical bills can rack up to a lot of money. That's why they have something called Medicare supplements. Medicare supplements, also a program designed by Medicare, offered by private insurance companies, that you pay a monthly premium so that you get the rest of your bills covered. All right. In our state, there are over 60 Medicare supplement companies offering up to 10 different plan choices for people. A, B, D. We're missing one. The one we're missing is on the other side of the page, which is called Medicare Part C. Medicare Part C is what's called Medicare Advantage, and this is where a private insurance company creates their own health plan. Now, they have 2 obligations to Medicare. One, they have to cover every condition that Medicare would have covered. You can't have an insurance company saying, we're not going to do knee replacements because people are getting them too much and they're costing us too much money, so we'll cover everything else except for knee replacements. It doesn't work like that. If Medicare would have covered that condition, they have to cover it. And they have to cover it to the same level, the same 80% that Medicare would have covered. Because as you see, A and B is on one side, A and B is on the other side. That also means that the cost for B is on both sides. But what the Medicare Advantage plan can do is they can then bundle stuff together to make the plans look more attractive. These plans can bundle a drug plan with it. Still a separate drug plan, but it's bundled together. Or they can offer things like vision or dental or other extra benefits, things like over-the-counter benefits or a health club membership or the help I've fallen and I can't get up button. They can add those as a marketing gimmick to make you want to buy those plans instead of being on the other side of the page. Okay, but you still have a gap. You still have 80% coverage. You still have to cover 20%. But you notice at the bottom, you can't add a supplement there. These plans have a maximum out of pocket, similar to what you might have been experienced when you were working or before you went on Medicare. So they have a maximum amount that you could be charged. Well, how many of those are there? In our county, there's 47 Medicare Advantage plans to pick from. Anybody want to do a little bit of math? That's easily over 7,000 possible combinations. Now think about who's eligible for Medicare. People who are on disability for over 2 years, or people turning 65. People turning 65 as they retire, what? Maybe they've been with an employer their entire life and their decision was picking between option A or option B from their employer. And suddenly they're faced with over 7,000 possible combinations, and Medicare expects them to figure it out on their own. Confusing? But the government makes it easy, especially because you may want to enroll at 65, you may not want to enroll in 65, but there's still going to be an enrollment time period for you to do it. And the government makes it easy in terms of that because they have their enrollment windows. Here, let me explain this. I actually need a drink before I do this. I'll set that here. The enrollment periods are pretty easy to track because once again, it's a government program, so they make everything easy for us to do, right? The first enrollment period is your initial enrollment period. This is 3 months before the month you turn 65, the month you turn 65, and 3 months after. That's when you can start your Medicare process. Then there's a special enrollment period, which occurs 8 months after you lose your group coverage if you had delayed your enrollment and missed your initial enrollment, but you were still working. Then there's also the annual enrollment period, which is October 15th to December 7th. But this is only for people wanting to get into a Medicare Advantage or a Medicare drug plan or make a change for the next year. Now there's the open enrollment period, which actually used to be called the disenrollment period, which occurs between January 1st and March 31st. But that's only for people that are in a Medicare Advantage plan who want to get back out of it or change to a different one. There's also something called the general enrollment period, which is if you missed your initial and your special enrollment period, and you still want to get on Medicare, so you can sign up during the general enrollment period, which is also January 1st through March 31st. And then there's, in addition to that, what's called a 5-star enrollment period, where if you want to get into a 5-star plan, you can do that once any time of the year, but that only counts because we only have one plan like that in our region. Easy, right? Everybody follow along and get all of that? I can. But our government, once again, is looking out for us. They're trying to make things better for you, okay? I would hazard a guess that there are people in this room that have, I don't know, received phone calls from people wanting to talk to them about Medicare, okay? You don't have to reveal yourself. Anybody remember those commercials? Came up last couple of years. You'd see them all the time. Medicare beneficiaries. Do you know you're missing out on valuable benefits that you deserve? Joe Namath, J.J. Walker, Ozzie Smith. Medicare started in 2021, and put a rule in place in 2022 and has now modified it even more for 2023 on something called the final rule. And the theory is to help protect you. It's meant to help reduce marketing misinformation and people getting confused into what they're doing. And it's required several things. Like one of the things it's now requiring again that they took away and bringing back is they require a 48-hour notice. For me to meet even with my own client, I have to get a written or electronic, what's called scope of appointment, filled out and approved 48 hours before I can actually have a conversation with them about their products. Even this is not new products, new clients, my own clients, I could do that. I now have to record all of my phone calls. And within the first minute of my talking to somebody, I have to read a disclosure. We do not offer every plan available in your area. Currently, we represent this number of organizations which offer this number of products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program to get information on all your options. And the funny thing about that is they don't have all the information. Medicare.gov does not list all of the specifics about all of the plans. The only way you can get that is by going to the actual insurance company, which I have more information than they do, but I have to send people away before that I can ever even talk to them. Does it sound like a good system? The theory is that it would prevent the scam artists and the unethical agents from trying to take advantage of people. The problem is that it's made it harder for good agents and the bad guys are still doing it. The bad guys are still creating problems. What are they doing as unethical agents? They're ignoring the marketing guidelines. Medicare has laws in place that say what can be done. Anybody ever received a phone call from somebody trying to sell a Medicare? Well, that may be legal, but more often than not, it's probably not. They talk about and they claim that they work with Medicare or they're approved or authorized by Medicare, and it's patently illegal for them to say that. They pull a bait and switch. Whole bunch of commercials going on last year about how people could get their Part B premium rebated to them back on their Social Security check. Yeah, there are programs that do what's called a Part B rebate, but it's not the full amount and it's not in this area. But as soon as they get you on the phone, they're trying to switch you to something else. Their goal is to make a quick sale. They don't provide any support after the fact. And so what does that do? It creates a confusing environment for people out there because they don't know what to do or where to turn to. So where am I at on time? I got 2 minutes that I'm pretty close. All right. So I don't know if this is going to play or not, but this is what happened when a scammer called me, in case you never heard about what it sounds like when they call. Let's see if it. Okay. So the volume's not there. So if you ever want to hear it, let me know and I can play it. I'll put it up. I'm planning on making a video about it on my website, but they actually called me. They called me, they represented themselves. They did a bait and switch. They started talking as soon as they could about how they want to talk about Medicare Advantage products. They violated Medicare law 8 ways from Sunday. And this happens every single day. So what do? I try to provide as much information publicly and answer any questions I can for anybody out there that has questions. For people turning 65, oh, now it started. Whatever. For people turning 65, I created this. There's a flyer on your page. I wrote a book. It's called The Top 5 Tips to Prepare for Medicare. It's got a good planning guide in it. This is for both people turning 65 or over if they're interested. You can get a free copy of this if you go online and go to the website. If you want an actual physical copy of it, I've got copies if you're interested in them. All I ask is for a donation to the Alzheimer's Association to help cover the cost of the book. We never turn people down for questions. If they have questions, they can just give us a call. And yeah, that's about, I guess, all the time that I have. I'm more happy to stick around if anybody has any individual questions. I appreciate your time and your attention for that. And I think I'm good.
Hey.